our feature webinar with Joan Hutchings and Dr. Natalie Archer. It's going to be a really good one today. So we're going to start at 5 o'clock. We're just setting everything up. Welcome. In the comments, say hi. Let us know where you're from. It is live now. We're just going to share the link with you on here in the webinar. So today we will be, our topic would be on preparing and training your practice and team for health inspectors and labor board audits. Will you pass? That's a really good question. We'll find out today if you will pass. So we'll get the link for right now. We're live on YouTube, I think. So we're almost live on Facebook. We got most of our views from Facebook, actually. So if you are on Facebook, try to find us, Dentistry Business, and like and join our page. That's where you'll be watching a lot of these great live and pre-recorded webinars. Business. And just let us know what type of topics, if you're there in the comments, let us know what type of topics you want to learn, or a certain type of things you want us to cover in the future webinars. Okay, and we are live in Facebook too. So share link. And how are you doing today, Joan and Dr. Archer? Are you excited?
Yeah, doing well. It's been a lovely Remembrance Day. Yeah.
I'm streaming from Kingston, and Sharky and I had a little conversation earlier, and I was disappointed that Toronto got all the sunshine today. We've had a lot of cloud and a lot of rain and wind, so it's like we're almost in a different environment for sure.
Was it all sunshine for you too, Dr. Archer?
Oh yeah, no, this is a very good gift, this weather. I was able to sneak out of the office today and go for a good walk in the afternoon, so that was very good. A rarity in November, right? This time last year we had snow.
Oh, did we?
Yeah, I remember it.
Wow. Yeah. It was warm, and then it got cold a couple of weeks ago, and I'm thinking, oh, that's the end. Yeah. And then now it's warm again. It's like, wow, it's like we skipped winter and now back to spring.
So, very good.
So we'll start in a few minutes. I'm just checking everything on Facebook. So if anyone have any questions, please type it into the comment section. And remember to like and follow us on YouTube or on Facebook. And right now we'll open in about 4 minutes. We'll open the gates for everyone to join, and we can start. I have lots of questions, and I just want to save it for the actual webinar itself. So
excellent.
Don't want to give too much.
We'd like this to be very informative. We're going to try and make sure we get our materials presented, but the priority is to interact with our audience and answer any questions that we can. And if we can't get them all in, we'll welcome them to, email us and contact us through our website, which we will have on display. And we're looking forward to a good conversation.
Yeah, for sure. And just to let everyone know, going forward, we do have, with Dentistry Business, we do have about 40, 50 of these webinars already. Any topics that you want to know about, that you need to know about to help move your dental practice to the next level, make sure to go to dentistrybusiness.com and you're able to see that. And we also have a lot of great webinars coming up. Next week is a panel discussion where I will be hosting and a few great speakers from different industries, different perspectives, all in the dental industry, but all dental related, but in different professions to kind of give you different perspective. We have a tool from a financial perspective, Blake from a social media perspective, Dr. Dale Hergy from, I guess, a practitioner's perspective, and Sean, he's an ex-lawyer of dental peers he's from a buying group out in Ottawa. So he's been talking to his practices. So we'll give you a lot of different perspective next week about challenges and how to prepare yourself for 2021. Wow, 2021 is almost here. Let's hope it's different. Let's hope it's go back to normal in 2021.
Oh my gosh. Yeah. The new normal.
Well, with the information about the possibility of a vaccine coming in the spring is certainly promising. They've done a wonderful job in the research community of bringing things together across the world.
Yep. I think everyone's looking forward to that, and let's hope it works. There's a few vaccine coming out or making good progress.
Mm-hmm.
The more the better, right? The more the merrier.
For sure.
And we're 40 seconds away. And we have, can you guys let us know if it's working for you on Facebook? I see the video. Let's see here. It's not loading for me, so let's see here. We're starting. Oh, it is working. Okay. Hello, everyone. Now we're live everywhere, and we're starting. So we're just going to load up our special preview video.
Hi there, my name is Dr. Natalie, and I'm speaking to you today on behalf of Safe Dentistry. Safe Dentistry is a program and package put together specifically for dentists and their dental offices to keep your offices safe, to minimize the risk of infection, to keep your teams trained in the event of an inspection, whether it be from the RCDSO, whether it be a complaint, whether it be the labor board, and now even more so health facility inspections that's happening to dental offices. As a dentist myself, practicing dentistry and owning a dental office, I can appreciate firsthand the complexity, the time, and all of the challenges that face as a dentist owner in terms of what it means to keep your offices compliant, highest standards, and safe right now, especially during the pandemic. On November 11th, myself and my partner Joan will be available to speak with you in an open format and to provide some tips and tricks in terms of what we can do to help you and your offices stay safe and compliant to the highest degree for any of the inspections coming forward.
Hello, everyone. Welcome to another Dentistry Business webinar. Today we have two great speakers, guests for you, and our topic is preparing and training your practice and team for health inspectors and labor board audits will you pass? So that's a really good question, and how to minimize the amount of time and resources you need by better being prepared. That's a very important topic. And so we have two great speakers here, Joan Hutchings and Dr. Natalie Archer. Be covering that. Just a quick introduction about dentistry business. We are your source for dental industry education, everything you need to grow and thrive, to grow your practice and thrive. We probably have a webinar on our site. We probably have covered it. So go to dentistrybusiness.com and you'll be able to see all the past webinars. Our goal is to bring you the top speakers with the latest information to help you prepare. Quick background on me. I am Sharky Liu. I'm the founder and CEO of Dentistry, a dental marketing and technology and service company. We help dental practices grow their new patient acquisition. Typically, dental offices that we work with increase new patients by 40 up to about 200-300% using our technology and methodology. We started the company in 2010, and I also teach the dental marketing and social media fundamentals course at the University of Toronto, as well as host a dental marketing conference. And our featured speaker, one of them is Dr. Natalie Archer. DDS is the owner and operator of 3 successful dental practices in Toronto under the umbrella of Archer Dental. Under her leadership and excellent staff, Team Archer Dental has won numerous patient appreciation awards, in large part due to service excellence. Dr. Archer is excited to devote all her energy and resources to safe dentistry and to work with Joan Hutchings to solve an enormous problem in the dental field, which is compliance with infection control professional standards and best practices, which is very timely right now with the second wave for us in Canada and the third wave of the COVID virus in the United States. And Joan Hutchings, in collaboration with Dr. Archer, is the designer of the SAFE program. She is the lead clinical consultant of SAFE Dentistry and is primarily responsible for conducting and monitoring all audits. Joan has 35 years of experience in healthcare space as an epidemiologist, surgical suite specialist, and registered nurse. With her academic background and extensive clinical experience, she is an expert on infection prevention and control practices. As registered nurse and surgical suite specialist, Joan was the director and clinical instructor of the Operating Room Technique and Management Program, a hospital-based surgical program. So welcome. Thank you for taking part today. So I'm just going to load your slides for you. So I'm just going to unmute you. There we go. So today it's going to be a little bit different. We'll take a little bit more formal kind of discussion approach to it. So everyone that's watching us on Facebook, LinkedIn, YouTube, anywhere else, feel free to post your questions there. And I'm just going to post a link here in the chat for Facebook. So you can take that link and feel free to share it on your Facebook page so all your friends and family are able to watch this live webinar as well. So I'm just going to load. So how are you doing today?
We're doing well, thank you. Thanks so much for having us, Sharky, for giving us the opportunity to use Remembrance Day evening to share some information on what safe dentistry is about who we are, what we can do for dentists. And I'll let Joan just start on our introduction.
Thanks, Natalie. Thanks again to Sharky. We really appreciate your time and organization. This is great. First of all, thank everybody, as Natalie said, coming and spending a little bit of time with us this evening is wonderful. We hope that we make it certainly worth your while. We're looking forward to providing what we consider an informal forum tonight. We've got very limited slides. You'll see as we proceed through the presentation, but what we would really like is having a dialogue with the watchers or the participants as we go along. If we have too many questions, what we'll end up doing is either trying to cover them at the end of the presentation, or we'll invite you to send them on to our through our website to us, and we'll carry on when this presentation's over. So having said that, again, welcome everyone. First, I always like to make a little bit of a disclosure. We try, Natalie and I both, all information that we present to our clients or on educational sessions like this is based on the current science-based evidence to the best of our ability. We really like to deliver you current information and interpret it in a way that is understandable, but also as close to factual as possible. Just a little bit about Natalie and I. Together, we have more than 50 years experience in the clinical environment, which is, I think, pretty impressive when you think of it. With her working in the dental field and my expertise in infection control and epidemiology, certainly now with COVID, this is certainly an environment that requires a lot of watching and monitoring of infection control and practices in the dental office. So our program, just a little bit, we'll talk more about it throughout the seminar, but I'd like to just say that what we do is really focus on helping dental offices to improve their infection control policies and procedures, having their dentist office be as safe as possible, and being prepared, as this seminar is titled, for any audits that may come through. And now it's not only public health, but as you'll see in a few minutes, there's a lot of influence now from also the Ministry of Labor. So we'll touch base with that in a little while. And lastly, I'd like to just define Safe Dentistry, Inc. The word safe has a meaning behind it, and that stands for Standards Achievement Facility Evaluation. So that's what we premise all our program on. The Safe Dentistry program is helping the clinics meet the minimum standards, but surpass them as we go through and you become partners in our membership program. So having said that, Natalie, I'll pass it back to you and then we'll proceed. Thank you.
Sure. So as a dentist, practicing dentistry, a few years ago, Joan and I came together when the RCDSO had its infection control guidelines, and that's what we practiced. And then at some point there was the ministry that differentiated themselves from the RCDSO. And it was at that time that we decided to come up with this consulting service that was specifically designed for dentists and their teams. And being a dentist myself, probably infection control or knowing how to sterilize things myself, or the various different things involved with reprocessing instruments, ensuring managing, being an example to your team was a challenge for me, because I actually probably could not, and I would challenge many dentists out there watching it, how many of us could actually open up the Steri Center or do things exactly, the way that we're supposed to do. And so with that lack of knowledge, how is it that we can ensure our teams are following it? I am very blessed. I have 3 offices. So for many of the dentists out there that truly want to practice dentistry and focus on our patients, which is what we should be doing, we need to have systems. We need to be able to ensure that what we're doing today, especially during our pandemic, is compliant. And it's a challenge. And I have been extremely humbled by Joan's abilities, her program for even our own offices, and what we've learned and what we've struggled with. And I'm happy to share any of those examples with the various different viewers out there either today or outside of this webinar. But it's really important because what I think sets safe dentistry apart, or what I hope to achieve, is that it's not just a matter of getting ready for an audit. You know when the auditor's coming, you know when the inspector's coming, you get all ready, then she leaves or he leaves, then you go back to your old ways. Safe dentistry is designed as a program where it's just an ongoing. Joan's been amazing at working online with the various different dental offices, the infection control officers, remotely. So again, COVID's just been perfect opportunity for that. So I'm happy to answer any of those questions. Yeah, but there's definitely a lot of challenges that I can say firsthand, that when dentists really do want to do things in a compliant way, there's a lot of different hands in the cookie jar. And I think one of the challenges that we can discuss about is how do you ensure, you know, everybody's doing things the way that they should be doing. And that's where safe dentistry really has come in. And the other wonderful thing is just having Joan be our auditor coming in and asking questions like, show me how you use your IWAS station. You just had a needle point injury. Where's your systems and setups for that? How does that work? And it is amazing how your infection control officer person will answer it to an auditor. So like I said, it's been a very humbling experience, but amazing. And our team has grown from it. And it's just an ongoing thing where the goal, I think, for safe dentistry in working with dentists, their teams, is to ensure that if a random inspection comes in, if things are happening on a Friday afternoon and you, the dentist, are away, you know, could you pass? Could something happen and would you feel good about things? If you were to watch a video of how your office or operatories work, how would you feel? So those are some things to think about. And I'll go back to you, Joan.
Back on.
I don't know. Did I lose Joan?
Yeah, I sure
happy talking.
I just showed hers down for a bit while you were talking, and apparently I can't turn it back on. I could turn it off. So we'll wait for her to get it back on. So you just click on the video icon on the bottom of the top, and you'll be able to come back on, Joan.
Sorry, what do I have to do?
But that's for Joan, for her to come back on. So do you want to continue while she
I'll
figures
keep
it out?
talking until she comes back on.
Sure.
The other thing I think that sort of sets us apart is sort of the ongoing relationship, which I really like. And again, I'm not sure how many of the consulting teams out there have a dentist on it. So I really appreciate, you know, we've priced things to make sure that we're extremely affordable. We are sensitive to the fact that nobody wants to take practice or production time or patient scheduling time away from different things. So the flexibility that Joan's been able to do, which has been amazing. And I think also can appreciate probably all the dentists out there or hygienists who are watching, is just the very fact that our regulatory bodies, the CDHO and the RCDSO, have different guidelines. So, you know, it makes it very challenging when one provider can polish and another provider cannot. Or our whole things on aerosol generating procedures, and now what we're learning and knowing about the virus. So, I see Joan coming, I think, back on. But those are definitely some challenges that every office is facing. And even some of the hygienists that are coming, you know, and speaking to me in terms of their temping experiences of the various different schemes and streams of how things are being done there. So I'm listening to all of that information, and I say to myself, you know, the higher we can keep our standards, the better things are, the better it is for the whole dental profession. Because really what we want is we want patients to know and feel safe. We want our teams to know and feel safe. Definitely since March or COVID has come about, we do things differently than we did before. And sometimes it's so easy to revert or go back to the way that we used to do things, or we need to ask ourselves, why am I doing that? How many wipes am I using for wiping down the room? How do I start wiping down the room? What do I do when I see one of my colleagues who's not doing something right? So those are all the sort of things that we're working as a program. And Joan, I see you back on, so I'm going to shove it over to you.
Okay, thank you. Just to carry on with that one last point about the program, and I think it's very important and it's probably timely now, is when a dentist office and their team have completed the Safe Dentistry program and have met the minimum standards, as we say, minimum, but always looking at setting the bar really high in terms of infection control. But it provides three things mainly for, as Natalie mentioned, the patients. That's the number one thing. We provide you with a certificate that you can display in your office that allows your patients coming through, and perhaps ones that are accompanying them are not your patients yet. It's very impressive to see a sign in an office to say that there's been the due diligence of the dentist and the team to take the time and spend the investment, which is a good investment to take, to ensure that their office is a safe place. And that goes for the employees as well, whether it's the dental hygienist or the dental assistant, or also other associate dentists who come in. They need to know that the office they're working in is compliant with standards and that they can depend on the team. So these certificates displaying in the office and being able to be posted on, your websites and so forth is very beneficial in the future for patient recruitment and satisfaction. I'm going to move on now. We're going to talk about public health audits, and it's going to be very quick because I don't want to get into a lot of detail. But first of all, public health is an agency. It's at arm's length to the Ministry of Health. And the primary focus of public health is to protect the public, obviously with the name. So basically what happens, there's three types of audits, and public health is not just with dental, it's with any healthcare organization that provides a health service to protect or to prevent any disease process in the population. So basically, public health has three types of audits. We have what's called a proactive, and that's, I think, what Natalie was talking about. They have sometimes a random audit. They'll just, for whatever reason, pick either jurisdiction or something and say, we're going to go and see how that dentist office is doing. So that's number one type of audit. Number two is one where there's a complaint. And the complaint can come from anybody. It can come from workers inside the dental team. It can come from patients. It can come from anywhere. And once a complaint has been filed, it is acted upon very quickly within a few days. And depending on what the complaint is, the professional body, the College of Dental Surgeons would be notified that there's this complaint that's been put forward. So there's a process that's taken place once that ball gets rolling. And as a dentist, you just have to open your doors and allow people to come in, and they'll do their work. And at the end of the day, or the end of 2 days when they do the audit, you'll find out if you are given verbal suggestions or recommendations on how to change your practices to meet the compliance with infection control, or you will be given a notice to close your doors until you're able to satisfy the requirements of public health. The third type of audit that happens is what they call as a critical incident. And that would be something that's health threatening. If there was something that had to do with, perhaps right now with COVID, it would be if there's an outbreak of COVID in your office. So that sets a priority. If the ministry, or the public health has that type of feedback to them, that's an immediate thing, and they act on that very, very quickly. Just wanted to touch base regarding these three types of audits. There was an interesting article that I read not too long ago that was produced or published by CBC in conjunction with Marketplace. And what they found was the Ministry of Health had decreased, in fact, almost eliminated the number of proactive audits that they were conducting in the public. And with that came some very devastating effects of that. And those being that instead of doing 600 and some audits per year, and this was in 2018, so it's relatively recent that this change in terms of public health being more involved in inspections. But so their inspections went from an average of about 600 and some 50 a year, and this was in long-term care, though. I just want to point that out. It's not in the dentist office, but there are similarities that I'll get to in a minute. By decreasing the proactive audits, what happened is that they found that the proactive audit was very comprehensive, and they looked at all the things in the offices or the long-term care facilities that they were in. So they were looking broadly at infection control specifically. But when they reduced the number of those, and they were only entering these organizations either via complaint or critical incident, what they found by looking at the data, that the inspection that covered the infection control component of a regular audit dropped 70%. So when a complaint is filed or it's a critical assessment, they really focus in obviously on those specific aspects of the office or the clinic. And they're not broadly looking at all the activities to ensure that all infection prevention and control activities are being carried out properly. So having said that, it's imperative that dentists now, that's what we're talking about now, understand the importance of having a proactive audit. An audit meaning just having somebody that has fresh eyes coming into your office with expertise in areas that you may not think of are important, but they're extremely important in the long run. So I think that's an interesting fact, that the findings that the proactive audits are 3 times more thorough than the complaint audit and 5 times more thorough than the critical audit. And those would be the kinds that you would be seeing. So even if you're audited, you're probably unlikely not going to have a comprehensive that's going to pick up all the, the fine details of where you could perhaps be doing a better job. And at the end of the day, the whole idea of safe dentistry and audits are to protect the public and protect your workers. Just a few things as far as audits go. The IPAC, Infection Prevention and Control, the areas that seem to be continually being the top focus at this point, especially during COVID, is personal protective equipment that's still not being handled properly. People are not putting them on properly or taking them off. They're not washing their hands after they, don gloves or take them off. It's really important. Hand washing and hand hygiene are the #1 safeguards against spreading diseases. The others that they focus on is the reprocessing and the sterilization areas. And again, being an operating room specialist, these are areas that I know are very challenging for dentist offices. There's quite a difference in what your staff, what your physical setup looks like compared to what a hospital has to provide. With the same services, though, you have to provide is making sure at the end of the cycle that your instruments are cleaned properly, they're sterilized, and that they're not going to be cross-contaminating patients and infection. So it's very important that these policies and procedures are followed in the greatest detail, and that you have the opportunity to have the education and the training that's necessary to provide service at this high level. Other areas that have been kind of the top priority for infection control is environmental cleaning. And just how, as Natalie pointed out before, what is the appropriate way to clean a room? Do you start like at the door, or do you start, with the equipment that you've used right away? How far from the chair do you navigate out to clean things? What type of equipment are you using? So again, there is a really solid methodology about the proper way to do things, and it's very critical to the outcome of what you're doing. If you don't change, or you're not using your disinfectant properly, or you're wiping counters down with a dirty cloth, you're actually causing more harm than good. So all of these details are things that we can pick up in our friendly audits. So I've lost my slide.
Oh,
Oh, there it is. Thank you.
you want the next slide? Yeah.
So I'm going to move on now because we did talk about, I'm not so sure that, to me, this was a little bit surprising, hearing more of the Ministry of Labor audits, specifically relating to COVID. Ministry of Labor is a ministry that particularly works for the protection of the worker or the employee. But they have three main areas that they focus on, and the one I'm going to concentrate on tonight is the occupational health and safety. So it's through this type of responsibility that this ministry has that has now increased significantly in terms of healthcare settings. And that comes through mainly complaints that are being reported to the Ministry of Labor from staff. And it seems to be more, and particularly from the dental hygienists. And we'll touch on it just briefly, but I don't want to get into all the differences, but certainly you're aware of the differences between the regulations and the standards in both of the colleges. So having said that, the Ministry of Labor is getting numerous phone calls and reporting from the dentist offices from various staff people, and it's having to be mostly involving areas like personal protective equipment, whether they're being using the proper masks, the proper levels of masks, whether they have the supplies that they feel, they meaning the people, the dental hygienist that perhaps has phoned in, not feeling that their health is being protected. Other areas is the environment with the aerosol generating procedures. They do most of these procedures or a large number of them. And they're concerned about the air quality. They're concerned about has the dentist provided the necessary safety measures to protect their health? As they sometimes information is not disseminated to the staff as well as it should be. If you've done air quality evaluations, that's a good thing to share with your staff so that they have an idea that you are, doing your due diligence to make sure that the office is safe. If you have to change and bring in high vac suctions or air changing that. And again, I don't want to spend a lot of time, but there's a lot of focus on air quality and how you can improve that in the dental office. So that's where the Ministry of Labor comes in. The other one is obviously if there's any problems with safety, and this is where your WMIS program that we talk about and we look at a little bit in terms of your policy and procedure manuals. It's important that your office is safe and that you provide all the necessary information and guidance and training so that your staff are feeling comfortable and that they can function to the best of their ability and provide safe services to your patients. The other thing I just wanted to point out, if the Ministry of Labor does appear at your door, they will, same as the public health, you can't say come back tomorrow. You have to let them in and you have to provide them with everything that they ask or require you to produce. One of the things that is important is that they will start to they'll focus on the issue that was brought to their attention, probably something about PPE or air quality. But once they get in your door, they have the right to look at everything. And that's where they'll step up and start looking at your manuals. They'll start asking questions about, do you have a safety officer or person appointed in your dentist office? If you have more than 20 employees, do you have a safety committee that is by law you have to have? So there's a lot that goes off on that arm as far as, again, that are included in the infection prevention and control standards. So the Ministry of Labor is They've hired, I think they told me there's 300, I think, in Ontario inspectors. They've just recently hired something between 60 to 100 more. So the chances of your office, somebody coming for a visit, is increasing as they continue to hire more staff. And again, at the end of the day, it's important that you're prepared. And this is something that Safe Dentistry, our program, can provide for you, is to help you understand where you need to focus on, where you can get the information, and lead your team to be compliant with all the IPAC standards. Now, we have not asked anybody if they had any questions. Sharky, I don't know if we're moving on into our program now. Are you there?
Yeah, I'm here. So everyone, so we have quite a few people here in the audience. Please feel free to type into the chat, say hi, let us know where you're from. We have Karen, Dr. Amit, Beth, Pamela, Sabah, Jose. Thank you everyone for joining. If you have any questions, please feel free to type it into the comment section there. Everyone else on Facebook land, and YouTube land, and LinkedIn land. We got quite a few viewers from LinkedIn. Feel free to type in your questions in the comment section. We're watching everything. So do we have a question coming? Okay. Okay. So question we have for you, anyone that's watching, is that has your office been visited by a health inspector, labor audit board in the past few months? So please let us know if it has or hasn't. We'll wait for some feedback. I guess you could continue.
Yeah, as we're waiting for the thing, I just wanted to sort of speak to that. You know, when I'm listening to Joan, I mean, I don't know if any of the dentists out there, it's like your stomach goes in a big pit. I mean, honest to God, this whole infection control, these whole IPAC things, this whole COVID, these whole audits, we did not study for it. We were not trained for these things. I looked to the dental assistants who were trained. They were really trained well on infection control. Same with our hygienists were trained very well. I know dentistry now, it's been 20 years or so since I've had my training on that. And yes, we have that, but you can just appreciate hearing all of the things as a dentist owner, what we're responsible for knowing, overseeing. So it's very hard when you have 2, 3, 5 team members or various different things, all the things that we're supposed to be responsible for. And it's hard. And we created this program because I firsthand can appreciate how hard it is. I cannot be an expert in everything. I am not an infection control expert in many ways. Joan is. Joan has really upped our game. It has been, like I said earlier, a humbling experience. The thing that I have loved most about it, as hard as it's been at sometimes, is the fact that it takes the weight off my shoulders. Now I have an external consultant. Now I have an external body who is able to have the discussions, the training, asking the questions, going over things. And it is amazing when she speaks with my infection control officers 3 or 4 more times, a couple weeks apart. Every time she's asking for the same thing now, it's just easier. You have to remember, none of us generally as dentists go through an annual audit. The RCDSO does not audit our offices. I know medical offices generally do, so we're not even ready for these audits. But imagine external audits like the labor board or the public. These are scary things. So, you know, when we hear about all these extra things coming on, I said to Joan, I said, you know, we have to reach out to Sharky. Let's educate dentists that it's coming. And the best thing you can do is to prepare. Because, you know, although infection control, investing in all of these things is an investment, what we can't afford to do is, as Sharky was saying earlier, you know, close the doors. Bad PR is bad PR. Nobody wants COVID in their offices. Nobody wants these kinds of things brought to light. And yeah, so I just wanted to sort of speak to that because it is a lot. And so if you're feeling that overwhelmness, that's probably very normal. And that is one of the great things about the design of the program. And it's just supposed to be, very comfortable and approachable. And you kind of feel like, okay, you've got somebody now that can take that weight off your shoulders and work with your team to make sure that this is all being done on the side on an ongoing basis.
I think that's very good information, Natalie. I'm being an epidemiologist and somebody who just has a one focus, certainly working in the surgery programs and so forth, being involved with teams. It's really hard when everything depends on the weakest link on your team, and it's dangerous to assume that things are safe and risk-free until proven otherwise. The time has come, not only with COVID, but there are many other infectious diseases that are there and will never go away. There'll be a lot more to come, and it's time where everybody takes responsibility. And certainly in offices that I've found, speaking with different members of the team, everybody has a different focus, and it's really important that through somebody, again, our program, it brings together and fills the gaps of the team. And it's not now just the responsibility of the infection control person or the designate. They do have a responsibility to make sure that things are running smoothly, but they also have to depend on their co-workers and rely on them very, very much. And it's nice to go to work and being able to feel that you can do a good job, and at the end of the day that everybody's on the same page. Having an external person such as myself or somebody on the Safe Dentistry team, we also help to bridge the gaps. We bring in the expertise that allows the weight to be pulled off some of the people on your team. It's difficult to manage coworkers. It's almost sometimes impossible. People don't like constructive criticisms. They don't like to be pointed out that they've done something incorrectly. It's always a negative, negative, negative. At Safe Dentistry, there's nothing negative. We're all in the same boat to try and make sure that we do things as well as we can, that we protect each other, and that foremost, we protect the patients. So we change the organizational culture by having somebody out external. And as Natalie says, I'm in touch with different offices. I'm calling, or my phone rings the other way too. It may not be a scheduled meeting. It may be a quick question. How do we do this? Or where do we find this? And if I don't know, because I don't have all the answers either, but I am certainly able and have the ability to find things where your day cannot stop while you're trying to resolve a problem or trying to understand how we're supposed to document something. Like, are we documenting that, which you're supposed to now with COVID? Each chart has to have a physical, written, or electronic documentation that you've put your patients through a screening process. And that screening process has to be meeting the standards of the college and the IPAC standards. So it's a really difficult, complicated environment, and having the liaison with the Safe Dentistry program, not only with the consultant, but also with other members of your profession, really helps to build a strong profession overall. Were there any questions, Sharky, or will we just continue on with?
We're just looking through all the groups. There is a question from Pamela. She was asking if there's a way to get summary of all the manuals needed. Can we have a summary of all manuals needed? Yeah, are they what type of documentation should each dental office have in regards to manual or other kind of documents in the office?
If I can suggest to Pamela, actually I was just going to get Joan to put up our 5th slide about the challenge. So for Pamela and all those other people out there, why don't you visit our website, www.safedentistryincincorporated.com. It's a really great website. Every office is going to be different in terms of what you need, where things go. We obviously all need manuals, different things like that. Joan is a plethora and a Wikipedia of information. I thought we had pretty good manuals before, but apparently we did not. So she has definitely helped in that. And what I would say to Pamela and other people is like having Joan is like, it's like having your fake auditor like in your pocket. Like she is there to train and help. Obviously nothing is punitive in the sense that whatever is deficient, she's going to help you correct. And she's going to ask them, you know, she's got an amazing way of working with your team, which has been the greatest thing for me because, like I say, it takes the load off. But I have a challenge for all the viewers out there or office managers or different dentists, and it's to take the Safe Dentistry Challenge. Go on our website, complete the survey. It should take you 2 to 3 minutes. Take the survey on the website, be honest. And we're actually trying to do some prizes or different things. So, you know, COVID, I always say there's free things out there. Once you complete the survey, you give us your contact information. We're giving a couple of things. The first prize is like 1 free year membership to the Safe Dentistry program, which is awesome. Like I often say, it's a value of like $3,500. And for $3,500 for an entire 12 months or year of all the stuff you're going to get, you can't beat it. If you've got any complaints or problems, you don't think you get your value, I want to know about it. The second prize is your office is going to receive a 50% discount on the 1 year membership. And the third prize is a 25% discount. So one of the things I keep hearing from some dentists is they feel like too much, like it costs a lot with the PPE. It costs a lot, you know, in terms of digitalization that we've done for our documentation of reprocessing of instruments, which has been great for the team members. They love it. You know, installing virus killers or various different things. A lot of money goes out. I get it. But what Safe Dentistry will do is to ensure your workflow, your ergonomics, the way things are going to go. You do not want to be closed down. You want your team working at the optimum function with doing things. And the other thing I would have to say about Joan, of some of the feedback and little notes I've gotten from her, just in speaking with my own infection control officers, is, you know, we come to realize sometimes people do not understand why they do what they do. Like one of the questions, how many wipes do you use when you turn a room around? You know, there's like this face. Why do you do it that way? Why do you start cleaning at the light first? Nobody knows. You know, and it sounds so silly, but it's these kinds of things when you have somebody like a Joan who's an expert of this, will say, you know what, this is actually why we do it. This is why you don't touch your mask. This is why, you know, this is how you put your PPE, this is whatever. Or a couple of times that she's remote watched our offices in terms of, you know, how people do various different things or whatever, just that feedback. And the more habits you correct, the more it's just like common sense. And I have to say, Joan, you got to be so proud now.
I am. I really am. And it's amazing just how time and people focusing on what they're doing, as you've said, you almost in your mind, every time you make a movement in a professional environment, is say, why am I doing this? Every move should have a purpose. Everything that does, you should understand why you're doing it. If you don't, you probably aren't doing things properly. And we just cannot afford to not do things properly in this state of infections that, as we've talked about earlier, numerous ones, COVID being the greatest one right now. But it's not going to end there. We all have to pay attention, and working together and mentoring and sharing and questioning and making people start to really think about what they do and how they do it. And at the end of the day, I've had so many positive feedbacks. When I first come in, they probably think, oh my God, here she comes. And it is quite challenging, and it's conversations in the beginning are very stressful, I think, both for myself and for the team, because
I'm an auditor.
I'm like, yes, I'm coming in, and no matter which way you look at it, I'm the bad person. But, you know, it doesn't take very long as we start to talk and we, you know, get to know each other a little bit better. And I can demonstrate that I'm not there to punish anybody. I'm not there to pick things apart. We're there to work together, and being able to establish that relationship right from the get-go, which I have to say I'm proud of. I'm able to do that. And from then on, it's great. I have people that are phoning and asking, as they say, simple questions. Some of them are very complex. Some of them are something that, there's a new staff person and they're trying to figure out how the best way to train them and get them, hitting the road running. And it's a constant struggle. And I'm really grateful that our program can assist and take some of the pressure off and allowing the team to do their job and do it well.
So so here's a screenshot of the website. So where do we go to do the tests?
The survey. So you see where the little survey is at the top?
Over here?
You got it. So people can fill out the survey. Yeah, there's a bunch of just different questions. Answer them honestly. It goes into us, and I really invite everybody and anybody, please contact us. Let us know the feedback from today. What did you want to know but you were afraid to ask? What's your burning question? What are some of the challenges you're finding in your office? What do you hate doing about this stuff? All of those kinds of things. So that's what I would suggest. But it's just today's purpose is just who we are. We are here. We're real people. There is no perfect office, I say. There is no perfect patient. There's no perfect practice. But we do strive to minimize risk. And that's really what this is all about. How awesome would it be to feel that, after, a few weeks or whatever working with us, that Joan says, okay, I'm going to do a random audit. Anytime I'm going to pick a day within the next 60 days. It could be any time. And you come out with flying colors. I mean, that should be really good. It's also okay to cry too. Doesn't work out and your staff person doesn't know where something is, even though you just said it or whatever, but those are the things. So anyways, I hope, Sharky, that this has been helpful for your viewers and the people. And like I say, please contact us anytime. Joan is available to speak with you. We want everybody to do well. We want to be affordable. We want to customize something for you. And obviously working remotely and online now is the new normal. So that's great.
So can you describe the step-by-step? I'm not sure if any of our people watching actually been in an audit, but can you describe the step-by-step, what happens from, I guess, let's say initial complaint. Let's say they got a complaint. So how can the dental office prepare, and what can they expect at different stages?
Well, if I could speak to that, Joan, just first. So
sure.
What we did, so I told my team, and I didn't want to feel that they had any extra information, so I told them nothing. I just basically said, Joan is going to contact you, the infection control officer. She needs around 3 hours or so. She's going to do an assessment. I get the scores back. There's definitely room for improvement. So that's sort of in terms of the assessment with Joan, informally, whatever. What I loved about it was that, thank God, I used Safe Dentistry as the first vehicle for this, because whatever she's doing as the auditor is going to be the same as any of these other external sources. However, it's much more forgiving because this is not a formal audit. We have to remember that. And of course, again, to repeat, dentists are not used to having audits, or the infection control officers. And often when you have employees, sometimes they are not maybe as gung-ho to do things or go above and beyond, and if they don't know the answer, then, so, okay, what happened, sort of thing. So that, again, the onus goes on there. And then, in terms of an RCDSO complaint or an inspector coming in, where we can all appreciate if any of us have sort of had those kinds of things. If it comes from a disgruntled employee or something along that line, you're right, Joan's right. They come, they give you the card, they'll check what they want. You don't know what they're writing down or different stuff like that until you get some sort of fulsome report. And it's stressful. So I don't know, Joan, if you want to take maybe a minute or two without getting into too many,
Sure.
but just to highlight that.
I just want to clarify, Sharky, was that question about our friendly audit or what an audit would be perhaps from the public health or Ministry of Labor? Do you want to?
That would be from the public health.
Public health?
Yeah.
Okay. Basically, what the step-by-step happens is the complaint is made. As they say, it's if it's a random proactive audit, they're just going to show up at your door and say, we're public health, we're coming in to inspect your facility. And you basically have to open your door. They come in, they try to be as less disrupting of your practice on that day, but they still have to do their job and they've got timelines. So they usually will, focus on certain things. And I have to say, these people are not epidemiologists. They're not surgical suite specialists. So they're going to be looking at things in detail, but depending on certain areas they focus on is usually things that are hazardous. So they're going to look at, how do you deal with your sharps? Do you have your containers? Do you have things that are safe for your staff? Do you have eye washing machines where they're supposed to be located? Are people washing their hands in the wrong seat? Are they washing their hands when they take their gloves on and off? Are they touching their masks? They do all the general areas, looking at how the equipment is processed, or is it being taken apart? Is it being cleaned properly? Again, it's PPE being used. So they do their quick audit looking at everything that is outlined in the standards. So to be specific, they have generally, roughly speaking, about 60 points that they can look at to see where you're failing or that you're lapsing is what the term that they use. So they identify all these things depending on how serious these lapses are. For example, I know there's been a number of dentist offices that are closed, and at the end of their inspection, they will go to the owner and say, here's what you need to do. They're not that serious. You need to get these fixed as quickly as possible. They will give you a timeline and they will be back to inspect. If it's something that more serious where there's a problem with your sterilization, that you're not doing things properly or there's not documentation, they can say you need to close your door now. So you'll finish your procedure, whoever you're working on patient-wise, and your door closes. Then they will give you a timeline again to correct the deficiencies in your infection control procedures or policies, whatever they have identified. That timeline, then they'll come back and re-inspect, and then they will either give you the green light to reopen your doors, or they again can ask you to proceed and do more comprehensive work on your IPAC lapses. The other thing that's important to note, that once this happens and your doors have been closed, this gets posted on the public health website. So if you want, you can go, and this is public health has regional, I think there's 60 regional public health agencies. And depending on where you are, you would want to identify, you can look on the website, and these inspections are posted there. It identifies the lapses, and I actually have one right here that I won't name the name, it's on it, but I'm find my piece of paper. To explain kind of what the report looks like. What they do is basically outline what identify the IPAC standards that are not being followed. They list them and they say what needs to be done, and then reports back. So all of that information is clearly, I don't know, I've lost my paper, sorry. I wasn't expecting to have to report to it, but it's very telling once this gets on the website. And I've certainly heard from a couple patients that have been associated with an office that's been closed down, and it basically is, it ruins an office. It's very hard to build the trust up. Natalie can probably speak better to me, but I can say even from a personal level, If my dentist office was closed due to lapses in infection prevention and control, I certainly wouldn't be going back. There's plenty of dentists that you can move around to that have either plaques on their wall of, they're in a safe dentistry membership program like we offer, or that they come highly recommended by somebody. So in the business world, it is devastating to be caught with your hands in your pockets when you're having an audit. So it's serious. There's no doubt about it. But as Natalie said before, if you're involved in part of our membership, just having a second set of eyes and looking at everything, and we use the IPAC standards that are published by the college and by public health for dental settings. So we make sure that we're covering all the areas that they're looking at. So the chances of you having a serious lapse in one of the standards, if you're part of our program, would be virtually not existing. We can't guarantee that everybody's going to be perfect because we can't control how people carry out their daily activities. But what we can say is that by participating in the program, they're certainly better aware of what they need to look for, better prepared and educated and trained on what they need to do on a daily basis, not just in response to an audit.
So we have another question. What is the protocol for conservation of N95 masks?
What is the protocol what is the protocol for saving N95 masks? I'm not understanding the question.
Conservation of, yeah. Like how often should they be reusing it, and how to, I guess it's quite difficult getting N95 masks. Like how often should they be reusing it? Are there any ways to
that's a question that I'd like to just answer. It's really, you can't give a definitive answer. I can't say that you can use it for an hour, you can use it 2 hours. The standard is that you have a mask in the N95s that they're hard to come by. So it's recommended that you wear a surgical mask over them when you're using them to preserve them, because once they get wet and there's spray from your procedures, then the integrity of that mask has been compromised significantly. So it's not functioning. Having said that, it really depends on the wearer. And again, this is where we come in to educate individuals on what they're using for PPE. That first of all, they shouldn't be wearing them for all procedures. There's definite outlines of what procedures require them and which ones don't. When they're wearing them, they could also protect them by wearing a double mask, using the surgical mask to protect the outside. Depending on the procedures that are being done, it really is individual as to what your office can put in place for what needs to be done in terms of exchanging, or even during a procedure, there's a possibility that you may have to change an N95 mask. So Natalie, you may want to add to that. Certainly from an epidemiology point of view, you can't say you can wear it for 3 hours and that's it, or that you can put it on the shelf and wear it for 5 days. It really is individualized to the type of procedure and the usage of that mask.
Yeah, I think, speaking to Pamela directly, maybe I could probably figure out what we're talking about, or maybe what her situation is in the office, or those kinds of things. But sure, we can talk about those things.
Okay, any more questions? Feel free to post it up there. We don't have too much time left. So may take on a couple more questions from everyone. We're still trying to aggregate everything into one place. So I gotta look in multiple places. Streaming too much. And then, so what, from your perspective, from your experience, what percentage of dental offices do you think, if they were under an audit, would not pass?
Well, that's an excellent question. Joan would probably have a different answer. I would say I would be surprised if most dental offices on the first time pass with flying colors. Let's just put it that way. And you think you take your checklist yourself and you think you're going to do stuff, but then the auditor comes, and generally the dentist does not stay with the auditor. I did not in my case. I had 3 offices, so I delegated a staff person that I felt was trained to know where things were, how things were, blah, blah, blah. She'd get ready. You know when she's coming. And, you know, that's how the audit works. So, Joan, you could probably weigh in.
I'm a fairly black and white person. So to say, I have no hesitation to say that I would say no office will ever be 100% compliant at any given time. It's just impossible. But what we're striving for is to reduce risk. So in using that spectrum, there is a large percentage of offices that, based on the number of items that I use through my checklist, hover around 50 to 60%. That was surprising for me when I first started into this business. I was expecting to find things probably most cases above 75. And again, these are soft numbers. I can't say that I've done a formal study and research and that these are hard numbers. But from what I can say, and knowing the industry and knowing infection control, that's why it's so difficult to stay on top of everything. It's because there's so many minute details that would cause somebody, for example, if I'm in an office and right now everybody's wearing a mask because of COVID. And if I'm talking to somebody and they're talking and they're constantly doing this with their mask, and then I turn around and as we're talking and I'm able to watch because we're doing this all virtual, I can see somebody, because I have them take me in different places being discreet for patients that are in the office, but I can be seeing a variety of different activities at one time. And I can see that same person as they walk away, their dirty hands from their face, and then they turn around and they're starting to touch either something that is setting up for the next patient, or they've done something if they're, depending on where they are. So it's a constant monitoring. So you almost have to think that there's a friendly auditor on the wall, and every time you do things that you need to be consistent about, did I do something wrong or do I need to change my habits? And this, with support, helps to bring the team up to be able to identify these things. And as Natalie mentioned earlier in our seminar, there's a lot of bad habits out there. There's a lot of things that people don't understand. Even when you're using their hand alcohol rub, you see them use the squirt and they get a little squirt and you can literally, in one instance, I said to the person, don't rub that in, let me see your hand. And there wasn't enough liquid on that person's hand to cover, let alone one palm, let alone 4 sides of your hands. You need almost a half a teaspoon or 30 mils of this liquid to completely do a good job at disinfecting your hands and sanitizing them. So even right there, that's a point against the audit. That's something that is not proper hand hygiene. So that would be a non-compliant, touching your mask, another non-compliant. Let me see your manuals. Then I look in the manuals, and depending on what I'm looking for dates. A manual has to be dated. That indicates that it's been paid attention to. If the manuals are all over the place and there's 1,000 of them, if there's 10, there may be, 3 or 2 too many. Manuals are not there to just be pictures on the wall. They're there to be useful. And if you have too many, people aren't going to pay attention to them. So then we have to go and say, well, what's in that manual? Oh, there's no index there. So like, what use is that manual if there's no index? People can't find what they're looking for, usually in a hurry, or even to be able to satisfy an audit. That would be a non-compliant. So it doesn't take long out of these roughly 60 areas of focus that they start to run down, and you get pushing down towards the 50% or even less in terms of the final outcome of the audit. It's pretty, eye-opening, as Natalie has said earlier. You think you're doing a really good job, and quite frankly, you're not. But it's not that it's impossible. A lot of these things can be rectified very, very quickly, and then continually working to improve staff compliance is an ongoing thing.
And then, so how do you keep staff compliant if the dental office keeps on changing staff?
You mean staff turnover or just between the shifts?
Staff turnover, new staff members come in.
It's a challenge. So definitely for onboarding, we spend a lot of time onboarding what they have to be taught and trained, etc., and just regular training of various different things. So, one of the things that Joan has done well is, she's been able to teach the infection control officers, then, just a dissemination of information that's there. It was interesting. One of the things I think I found was that some staff were afraid to tell somebody else, oh, I saw you put your mask over there. Like I was afraid to say something. Or, this whole sort of thing, politics in the office and different stuff. But, Joan's been great on the culture. And I think that's important. And again, like I say, from a dentist perspective, if I can delegate that service, that whole thing elsewhere, it does change the culture of the team.
I think another important point on that topic is that you have to remember that all people working in a dentist office are trained. So there's a minimum standard and responsibility from their profession, whether it's a dental hygienist or a dental assistant or the dentists themselves. There's a minimum standard of knowledge that they themselves accumulated during their training. Having said that, there's ongoing education that dentist offices have to encourage and actually make sure that their staff are complying with any changes, whether it's with technology or whether it's, WMIS, again, that's something that comes up that you have to have, recertify. There's a variety of training modalities that are mandatory basically for your profession, and it's the responsibility of each of the individuals to make sure that they are doing their due diligence and doing their part and staying current with what is necessary. And IPAC is part of that. It's not just the responsibility of the dentist. However, it is the responsibility of the dentist to make sure that their office is totally compliant. So again, it's a team project, it's a team effort. And ongoing and continuously monitoring interaction with people, working with the different politics, as Natalie says, in the office is very difficult. You have to have somebody that is seen as a coach as opposed to the warden or the sergeant that comes in and tells people to do things. But quite frankly, there's times where the urgency is important to be able to have the dialogue with your staff to be able to say something that is beneficial for the team or for the patient, that you can cut, beyond the politics of the office and have people really understand that the whole reason that they're there is to provide safe, competent care for the patient and have a work environment that's safe for everybody.
Okay, so it looks like you're running out of time. Do you maybe want to close off by giving one big tip, one thing that dental offices can do?
Bring in safe dentistry. Join our program.
Perfect.
Mm-hmm. I would definitely agree. That's definitely one thing, and I think the other thing would be to take a look and ask yourselves, if you were to audit your offices or just be somebody on the outside, honestly, how do you think you would do? Do you if you knew a labor board inspector was coming on Monday to your offices, are you ready? Are you ready? Do you know, that kind of thing. So that's probably the best thing, because it is going to happen. And our goal is to keep everybody safe. Everybody safe.
Well, for my one advice, take the test, go to safedentistryinc.com to survey, see where you stand. I mean, the way I see it, it's two things. One is that you want to pass the audit. Two is that you actually want to keep your dental office safe, especially with COVID happening. It can spread very quickly, very fast, and it really hurts from a marketing point of view. Your dental office, if it has to close due to violations. Right? So that's I highly recommend that. And also, I guess on the flip side, you can use your safe dentistry or your audit as a marketing tool to help promote how safe and extra steps that you are taking for your practice. And what we've seen from a marketing point of view is that dental offices that promote their safety procedures, their infection control procedures, that's the main tool right now. Before COVID, it was about dental office being spa-like and all these amenities. Right now, most patients looking for new dental offices, the number one, number two, and probably number three priority is how safe is this dental office. So that's from my experience, and that's what I recommend. So I just want to close off by just mentioning our next week's webinar, the future challenges in the dental industry, how to prepare and position your practice to succeed in 2021. We have 5 speakers from different perspectives, doing different things in the dental industry, giving the tips from what they practical advice on what you can do to prepare for 2021. It might be a challenging year, just like 2020, and you want as much of a head start as possible. That's next Wednesday, November the 18th, 2020. If you want to reach out to me, there's my mobile number and my email. And this is the contact for Dr. Natalie Archer and also Joan Hutchings. hello@safedentistryinc.com. And last thing I would say is that right after this, go take the survey. It's at safedentistryinc.com/survey. See where you stand. And if you have any other questions, get in touch with Joan or Dr. Archer.
Great.
Thank you.
Very much. Thank you for this opportunity. Stay safe.
Thanks, everyone. Bye.
Bye.
Bye.